Hi doctors, how are you? Today we're gonna see the technique, one of the techniques that we can use to restore a class tree. Okay, we got several techniques, we can use different bands, something like that, but today we're gonna see one case like this one, that we can see a cavity a little bit longer. Okay, this is space longer than 3 mm, and we have an open gingival clearance. Okay, that will difficult a little bit more the restorative technique, because usually, like for an example, we're gonna use, in the cases that the restoration is small and the gingival clearance is closed, we usually will think only to place a slot band and press it against the tooth. But if we don't take care and we make this technique, we can see that the celluloid band, once I press it to the opposite side, we left too much space in this area, and we're gonna generate a restoration that it's open in this area, and the only contact should be maybe up here in this area, and that's not really fine. Also because, like in this case, we can see the contact over here is a little open. So if we restore with that technique that they usually used, pressing the band to this side, we can generate an open contact and a restoration in a triangle shape, and losing the real anatomy of the central. So for solving this problem, by this point you already perform your restoration. At this point you already send it to grade, and you have your isolation, and you must place your bonding and all the technique, so we can have the preparation ready to be filled up. Okay, so in this situation, the first step I would recommend to you is, when we place the celluloid band, we're gonna place it, and we're gonna take a wedge. Okay, this wedge is very important to place it as gingival as we can. Okay, why this is important, doctors? Because if we place it a little bit more incisally and we make pressure with the wedge in this area, the open area, the cavity area, we can cause that the celluloid bends inside and causing an irregular S shape in the restoration, because the celluloid band is gonna take another shape and not so straight. So I'm gonna try to place this wedge as gingivally as possible, and placing there my celluloid band. If the wedge is too small, we can change it to a little bit bigger one, so we can get that space cover up. In the case we have two open space between the tooth and the gingival area, and we don't have a wider wedge, we can place two wedges, so we can have a tight contact over there, getting it more stable, so we don't lose the celluloid band. Okay, so again we have that buccal area that we're gonna try to bend it a little bit in this way, so we still have the anatomy or the position in the facial area, and the celluloid covering and touching the contact area, right? Okay, at this point I'm gonna take some composite and I'm gonna place it with a packager in the deepest part of the restoration, so we can feel that facial wall. This step is very important to avoid spaces or bubbles in the more facial part of our preparation. We need to press very well. Okay, so we can press and cover that composite. At this point I'm gonna try to press the composite a little bit, making a little shell to the contact area. That step is important to trying to get that material in contact to the adjacent tooth, so we can avoid an opening contact that is so important for these kind of restorations. So again, find the material, I place it again in the same position, and I'm gonna push it down so we can fill it up, and the same moment I push it down, I press it to the opposite side so I can generate that little shell, okay, in that area. Now I'm gonna bend a little bit the superior part, as you can see, so we can press the celluloid in the incisal like rotation, natural rotation. At this point we can use a spatula to remove a little the excess from the corners. Later we're gonna see how to remove that excess in another ways, but well, we can handle it a little bit at this point so we can reduce more work later. As you can see, I have my shell touching the adjacent. Okay, getting that anatomy. Okay, like here, pressing a little bit the material. If you see, I'm not pressing the celluloid to the side of the prep. If not, I'm gonna lose that contact I just performed. I'm gonna lacquer it. At this point, thinking a little bit about the shell technique of the class 2, we're gonna see that now I can remove the celluloid band, I can remove the wedges, and we're gonna see that the composite took that shape touching the adjacent tooth. Okay, that's very important for me to get the contact area. And always making a shell is interesting and a good idea, because if by any chance I don't like it, I can remove it at this point instead of filling everything and having a complete restoration and then remove it. Okay, so it's easier to remove this step, that is only the shell, We can check the contact, that we have a really good contact right now. And yes, we have some excess in here. We have some other excess that we're going to handle a little bit later. But at least in here I have an initial shell that is going to help me to advance for the next steps. And also for me it's important for this example that it was a really big open contact, that even with that open contact, that the incisal part was open, that we got a really big facial clearance, we can get a good contact in the class tree. Okay, so what we're gonna do right now is to finish filling this restoration. Okay, we can use another systems like packagers to start giving that condensation, and always thinking a little bit about the anatomy, so we can give the lobule shape more wider or rounding this part, so we can continue the anatomy part. Okay. Always is a good idea to, with the spatulas, press in the unions between tooth and composite, so we can leave a soft surface of the material. We need to give that 3D effect with a good anatomy. It's not only a flatty surface, we need to get it all well performed. Depending on your technique and your ability, we can even place a little flowable composite. To give that roundy shape. And that lobule anatomy that is going to give us that shape. Remember, there's many techniques. You should generate your own technique, but well, we're going to give you some options, some choices to perform this. Okay. Okay, gonna remove it. We can start watching that good anatomy. Okay, following the anatomy of the tooth. A really big excess in here that we're gonna work, and missing some parts of the finishing. As you can see, also here we have an excess. Okay, but all this we're gonna handle it. Look. With the disc, soft like this, we can continue the anatomy of the tooth, removing that little excess that we're having. Okay, this is very important to take care of not to press maybe too much to that area to avoid open the contact. But if you don't make too much pressure, you can handle the excess and remove it even touching that central area, but not open it, the contact point. Okay, the more gingival excess, we're gonna remove it with another technique that I'm gonna explain later on. Okay, as you can see, the excess over there is much better. Let's check it up in lingually. Okay, at this point I'm going to remove the isolation so I can continue polishing. I just already placed the composite. I'm going to check occlusion, I'm going to polish the thread. This is the hard grind. I use it to, as you can see, as you saw, to remove excess. Once I remove the bigger excess, I'm gonna pass to the lighter grain discs or lighter colors in this softflex system. I'm gonna pass to a yellow one. Looking great. Okay, now speaking about the excess in gingivally, we have two options. The first option will be using a blade. A good number for blade will be the 12 that have the anatomy to remove the gingival excess without damaging the tooth and the gum. We can take a 12 blade and we're gonna reach this excess to remove it gently. Try not to damage the composite and the restoration. Okay, this is the first technique that we can try gently. Okay, always. As you can see, it pops really well, even gingival in this part, in lingual side. We can handle like this position. Okay, and remove the excess. That's first try. Second option, is going to be using these kind of strips. These are strips that we use in the school. If I place it in my contact area, I'm gonna have the possibility to open the contact because it's too wide. So I don't recommend it too much using it in the complete length. So what I'm gonna do is with a scissors, I'm gonna cut it in the half. And after I cut it to the half, I'm gonna cut a little pointy shape in the edges. So I'm gonna be able to pass it up. This technique you can use it also in patients, okay? So I'm gonna pass it up down the contact, as you can see here. And because the new measure of this strip, I'm gonna always push down and front, like incisal to palatal, but always going down. If I push up, I'm gonna have the risk to open the contact, okay? So always down, touching that part where I consider the excess, or where I want to reduce or remove that excess with the hard grind or the bigger grind surface part of this strip. Taking control of it and also passing the soft part to smooth it and start polishing, okay? And I need to feel that flow and that continuity between composite and tooth in gingival lingual. Okay, and now I'm gonna be able to see that part of this anatomy that I'm start liking it more, right? If I watch more, I can see here a little roundy, so I can use a little bit more the strip to handle it. Okay, I need to evaluate again, always a composite. As you saw, this class 3 was too wide, too open. So this is a technique for two open contacts, and we can handle it in a good technique. Okay, there you go. I like it a little bit more. I can use now the more lighter color in the discs that I have, so we can start polishing, rounding a little bit that areas that I want to work. As you've seen, I'm not pressing straightly to the contact. This is very important for the discs. The discs are used in an angulation, trying to 45, even we can have less angles over there. But if I press it in 90 degrees to the contact area, I'm gonna open it. So I'm gonna always try to search that angulation. Try not to get it straight to the contact area, so I don't damage my contact point, okay? Okay, at this point, I can use finishing boards. When we place the composite, always a good idea that if we got any excess or any excess margin, we pass a finishing board so we can remove that little textures in the union between composite and tooth, and we remove that excess that we are having. As you can see, the anatomy is not given with words. The anatomy is given when I cast or when I model the composite. Okay, there you go. We're gonna pass through some polishers. In all the different systems where you're gonna have darker color, or well, depending on the system, check the color that is the darker one. Usually the darker color is the more heavy grind that you're gonna use for polish. And we take care. The polishers, we use it moving around, okay, not to stay in the same position, because if I stay, I'm gonna burn. Now I'm using the softest polisher that I have. Okay. And then I'm gonna use an Astro brush to finish my polishing system here and give it bright to the restoration. Now I'm gonna remove the dust. And I'm gonna confirm my contact. Okay, that is so hard is there, as you can see it. We can hear the click. This is very important for the restoration. Okay. Also, we're gonna confirm that we don't have any margin excess that stops the explorer. If we got any, we need to smooth it and polish it again. Okay. You're gonna see the light over there, that the light gives that roundy continuity to the tooth. You can see it, the little light over there, that's the light angle, okay, that we give. You can see the continuity in here, okay, the composite over there, no space between here, no retention, okay. Again, this tooth had a diastema, but I can perform that roundy so we can close it. Okay, so now a moment to practice it. Any question? We see you at lab.